We're doing passive range of motion of the hip on a sideline position. So the client needs to be well supported. So he needs a pillow to support the neck. He needs another pillow to support the legs. The long side of the pillow needs to be parallel with the tibia, and the knee and the ankle need to be supported. Also, the bottom leg needs to be flexed so the low back is protected when we do extension of the hip. The client should be right on the edge of the table, so then you don't have to lean forward and hurt your back. So the first motion I'm going to do is flexion of the hip. So I'm going to grab the hip, okay, support the knee and the leg and the thigh with my left hand, and I'm going to do is flexion of the hip, okay, and back. So this needs to be done with no participation of your client. So flexion of the hip. And the return is called extension. So flexion of the hip. Okay. This can also be done in different positions, but just showing you how to do it in this position. I'm going to focus on extension. So extension can be done with the leg of the client wrapping you, the therapist. So in this case, I'm simply holding onto the pelvis. The hips are stacked one on top of each other, and I simply bring the hip in extension. Okay. You could feel some resistance of the client, either due to a tight rectus femoris of your quadricep, or tight hip flexors, or anything happening in the hip joint, or the low back, or the SI. Okay, so that's extension. Okay. If you're dealing with a heavy leg, or just for a change in how to hold the leg, you could easily wrap the leg on this hip, okay, and then bring it in extension. This will put more of a stretch on the quadricep of the rectus femoris of the quadricep, but works super well to get some stretch of your quad and some extension. Okay. With this client, it's better to do it this way so we don't limit the range of motion of the hip due to a limited tight quadricep. Now I can go further in extension. Okay. Next thing I'm going to do is abduction of the hip. Same positioning of the therapist. I'm going to simply abduct the hip. Need to make sure that the knee and the hip and the shoulder are in alignment. And I'm going to simply abduct. This will become handy later when we massage the hip with kinetic movement. Okay, so that's abduction, and the return is adduction. Abduction and adduction. Okay, we could combine abduction and lateral rotation, which would look like this, which often feels amazing with hip restrictions in range of motion. Okay, so that's lateral rotation and abduction.